Good afternoon. I'm David Miller, President of the University of Michigan Health System. Thank you for joining us today for a brief video update regarding our ongoing response to the current resurgence of the COVID-19 pandemic. We have all experienced the significant increase in the number of cases over the last 4 to 6 weeks. Although our lessons learned with the pandemic to date prepare us well for the current resurgence, it is also true that we are all tired, if not exhausted. It's not easy to respond to these circumstances yet again. At the same time, I know that our teams here at Michigan Medicine are resolute, and we are once again rising to the occasion to take care of both our patients and to take care of each other. This is occurring across our organization, in the emergency department, in our inpatient units, in our operating rooms and ambulatory care clinics, in our infusion centers, and across the health system. For this, I want to express my deepest gratitude and admiration for your courage, resolve, commitment, and your expertise. As we move forward, we will continue to be guided by the principles that have served as our foundation throughout the pandemic. The safety of our patients and our team is the most important principle. We will continue to balance care for patients with COVID and patients with other conditions, and we will continue to serve and maintain our commitment to citizens of the state of Michigan. I will now transition the presentation to Tony Denton, Senior Vice President and Chief Operating Officer for University of Michigan Health System.
Hi, everyone. I hope that you and your family are safe and healthy. Thank you so much for being here. And thanks for all that you're doing, your dedication and support to safe, quality, and compassionate care to our patients and their families. I'm going to provide some information to you on the latest COVID-19 Michigan trends from statewide initiatives and advocacy. As you all know, have heard or read, we are the hottest of all hotspots in the country with regards to COVID-19 infections. This is troubling news, but we all have to continue to work together to make a difference to change the color of the map. I do have some positive news, though, that is starting to emerge. The case rates are starting to drop. In the last day, it's been reported by 12.5%. The positivity rate is also in decline as of yesterday, which would have been the 21st, from 16% to 13.9%. In terms of statewide hospitalization, the trends are also starting to show some positive hope, where we are now showing under 4,000 hospital admissions. We're thinking that we are now starting to plateau and will likely see a trend towards decreasing census of COVID hospitalizations. On a regional level, all regions except Region 2 North are showing some increase in hospital COVID census this week. The fastest growth region is Region 5 and 6 on the southwest side of the state, along with Grand Rapids and the Upper Peninsula, which is Region 8. The rest of the regions in the state showed minimal growth. There is some concern about ICU census. Over the last week, we have seen the ICU census grow by 14% and now exceeding the winter peak census. The fastest growth was in Regions 1 and 6. Regions 1, 2, North, and 5 have greater than 95% overall ICU occupancy, also a great concern in terms of capacity for any COVID activity. 6 regions have greater than 30% of our ICU beds occupied with COVID, and Regions 1 and 2 North are nearing 40%. So this is the topic of conversations on a regular basis with chief medical officers about how to address these trends. COVID-19 ER-related visits shows a lot of the same patterns from the previous slides. That you can see, we're starting to show a decline as indicated by the red line having peaked and now starting to see a decline. All of that is such good news. In terms of conversations and policy at the statewide level, there are several safety initiatives that are in play. That starts with messaging. Both healthcare and state government are asking and pleading for more shots in arms as soon as possible to increase vaccination rates and progress, including other creative means to get shots in arms through mobile pop-up clinics, walk-in clinics, through creating engagement and partnership with communities in order to address equity concerns, colleges and universities to try to get shots in arms for students before they head home for the summer, and partnering with labor unions to have joint messaging about the importance of vaccination. Speaking more about vaccination, we are also enhancing our employer communications to inform and encourage unvaccinated individuals to ask reasons why they're not and have not chosen to be vaccinated yet, and to answer questions in order to inform and hopefully cause them to sign up. It's so important that we do this in a voluntary way. That's what we're trying to accomplish across the healthcare industry in the state of Michigan. It's so much better to have people make these choices. And we hope that we can have that conversation that will allow that to happen. The Michigan Department of Health and Human Services has also extended its order for gatherings, the size of gatherings, and wearing a face mask through the 24th of May at this point. The epidemic remains in place, and so it requires that we continue an all-in approach on all public health precautions. The mask requirement has now been extended to children ages 2 to 4 as of April 26th. The advocacy, the messages are the same. Nothing here that will be a surprise to any of you, I'm sure. Mask up, socially distance, hand hygiene. The goal remains the same, 70% and greater. Our role as healthcare leaders, as healthcare workers, is essential to role model and become vaccinated. Minimize travel and gatherings, continue to work remotely if at all feasible, and to be safe for self and safe for others. Once again, thank you for your attention and thank you for being here and all that you're doing for Michigan medicine in our community. I'd like to now introduce Dr. Jeff Desmond, our Chief Medical Officer.
So thanks, Tony. I'm going to talk a little bit about our operational preparedness for our inpatient capacity. And I think people have seen some of these slides before, and I'll try to be brief. Our guiding principles are really to keep our employees and our patients safe. That's paramount to us. Balance the needs of COVID and non-COVID patients, and I'll show you some data around how we're doing that, and really maintain our commitment to the citizens of the state of Michigan for the care that we're uniquely equipped to deliver. If you look at where we are now, here we are at the 20 to 30 ICU bed utilization range for COVID patients. And this has kind of been our decision-making grid as we've gone along. So what have we done? We flexed our ICU beds up in 8D. We flexed our moderate care staffing, and we continue to maximize the use of moderate care in other areas. But levers that we have to really manage are around managing our incoming volume, and that's around managing our ICU and general care transfer census, managing our ICU and general care census around our elective cases, and I'll show you some of that, and then continuing to support that moderate care example. So to briefly walk through steps that we've taken, we continue to support the COVID completion at home, and I will say that our teams have become very creative and effective at discharging patients, COVID patients from the hospital. And I think that's one thing that separated us from some other institutions where we've been able to manage high throughput of COVID patients. We've talked about our moderate care capacity. We are very judicious about capacity management and daily have a capacity management and outside transfer strategy so that we're sure that we're utilizing that capacity appropriately. And we've reinitiated and rebroadcast our COVID Connect line to help support care at other hospitals, which I think has been effective in limiting transfers and extending excellent care across the state of Michigan. We've previously had a elective schedule reduced to around 90% of activity to manage to a safe occupancy. We further reduced that last week to 85%, and we continue to take advantage of doing cases at our ambulatory surgery centers and then leveraging Chelsea Hospital. I won't go through each of these graphs, but these show you what we've done over time since November to manage to a safe occupancy level. The orange here is the COVID census, and you can see we've had an increase and decrease in our St. Joe's MSJ volume. You can see that we've increased our HC ICU capacity, and we've varied this as we've gone through the pandemic. And then you can also see here our overall CVC cases, admit date procedures, outpatient procedures, and inpatient. We've modulated that volume to be a safe census. This represents the most recent micro adjustments down to that kind of 85% level. This shows you some of the similar data at at the initiation, the peak of each of the last waves, both November and now the current wave. And you can see that our COVID census has fluctuated with that. You can see that our surgical census is modulated to help us manage to that safe level. This is where we are today. 78 patients in the adult hospital, 29 of those in the ICU, 5 patients less than 17 in our children's hospital, 1 in the ICU, and then 1 greater than 18 or greater in our women's hospital, and none of those are in the ICU. You can see that our micro adjustments have managed our ED volume to some degree. We have a lower number of boarding patients this week than we have had last week. We had very high volumes last week, and so took some impact of our micro adjustments to really feel that, but has made a big difference in our ED occupancy and wait times. And this is why we're hopeful, though we see kind of rising ICU census. It feels like our overall census is probably peaking or plateauing. Our positivity rate for symptomatic patients is declining, and our asymptomatic positivity rate's bouncing around, but it's come down a little bit. It's jumped up a little bit recently. So in summary, I think that we're on the plateau for our inpatient demand for COVID care. We're continuing to balance COVID and non-COVID care together. And with these leading indicators of the positivity rates and what we're hearing across the state, I think we can expect that we'll, over the next week or so, see a gentle decline in our capacity, in our volume of COVID patients. I don't think we're going to see some of the steep drop-offs that we've seen with previous waves when we had increased state restrictions or other hard interventions to drive the capacity down. But I think we'll see gradual decreasing as vaccinations become more prevalent across the state. And we do everything we can to encourage both our employees, our patients, and our staff to get vaccinated. So with that, I'll hand it off to Nancy May. Thank you very much.
Thanks, Dr. Desmond. What I'd like to talk about is where we're at today as a health system. I know you're tired and I know you're weary. As I enter the health system at shift change, I can read the weariness on your face and your body language. The last surge has been a lot for all of us to cope with. We have teams that have not had any break from COVID care for 14 months now, and especially in our ICUs. We have one more hurdle to get over, and I am hopeful that as more and more people get vaccinated in the community, that we will be able to manage this COVID crisis that we're in and move to some state of normalcy. I cannot go on any further without thanking our teams. You have done amazing work, and I so am grateful for the work that you do every day for our patients and our families. Our emergency department has had an unprecedented number of patients that have come through over the last couple of weeks, and you have handled it with grace and dignity and provided extremely great care for our patients in need by actually creating additional space, surge space to see our patients in. This has taken a lot of teamwork and collaboration. Your fine assessment skills has allowed patients to be sent home versus cared in the hospital in some situations, and those that need to be admitted have been. Also, many that did go home have now been benefited from the monoclonal antibody treatments that have happened at West Ann Arbor Infusion Center. To date, we've done over 800 patients over in that center, and the nurses that have worked in the infusion area have been also very flexible to the needs of our patients that need care by extending hours as well as picking up additional shifts. We are grateful for that because we know that the treatment that those patients are getting are keeping them from getting admitted into the hospital and creating additional capacity challenges. In addition, our ABCC team has done a remarkable work every day at the 815 call. It's an interdisciplinary approach to manage each bed and do micromanagements on staffing needs as well as bed utilization. That would not be possible without great team effort from each of our leaders, not only our physician teams, but our nursing leaders. I look at what's been happening between our ICUs and the care that we need to deliver, and you have done an amazing job ensuring that you move patients out of ICUs as appropriate and move patients back into ICU beds that need to be. We have additional capacity in our moderate care through 6C as well as 7C, and I am truly appreciative to the teams how they've come together to find capacity for patients in need of care. Also, I would just like to say that balancing COVID care has provided challenges for our ECMO team. Our ECMO team has been working nonstop since the beginning of the pandemic, and we are grateful for the work you're doing. I'd also like to do a shout out because it's ECMO week for those healthcare workers. So thank you once again for all the work that you are doing. This would not be possible unless case management were really active every day on our patients on the units. They have done an amazing job of keeping throughput going by discharging patients in a timely way and linking services up to patients that are discharged so they don't reappear in our ED. So thank you to our case management teams. In addition, we've created a hospital home program where we've linked patients up to services in home care. Thanks to that team, because you also are creating capacity for patients that are sicker and in need of care. In order to make this all happen, though, our ORs had to work much differently. And what they did was take a look at critical needs of patients that needed life-threatening surgery and ensured that those patients remained on schedules. But what we were able to do is decrease some patients to lower acuity needs by transferring them out to some of our regional OR sites. The teamwork that it takes to create capacity is a huge lift. And these teams have done amazing jobs, and that I will forever be grateful so that we can get the sickest of sick of patients into our health system. In spite of all of this, our teams continue to focus on quality. And I am proud to say that many of you have received the 365 awards for quality and safety over the last several weeks. These are wonderful awards that really are true testaments to the care that you deliver. In addition, a special shout out to our award winners that received the Silver Beacon Award in our trauma burn unit, which is an ICU unit. That unit, their shared governance council decided they wanted to go after this award and came together and wrote out the application to receive this prestigious award. That is what nursing is about. Owning your practice and doing what needs to be done. I'm so glad that you've been recognized for the excellent care that you give under Lori Pelham's leadership. Before I hand off to our next speaker, I want to thank each and every one of you for making this work. Without teamwork and collaboration, we would not be where we are today at Michigan Medicine with managing this pandemic. Next, we are going to hear from Dana Habers, who is leading our vaccine task force around data and vaccinations. Thank you.
Okay, thank you for having me. This is Dana Habers with the COVID-19 Vaccine and Therapeutics Task Force. Appreciate the opportunity to give an update today. I wanted to start with our statewide view and how we're progressing towards our goal of getting 70% of the population vaccinated in order to achieve herd immunity. Here in Michigan, we're sitting at about 32%. So have a little work ahead of us. And as you know, we're continuing to experience resurges of COVID cases, hospitalizations, and unfortunately, deaths. Within our Michigan Medicine operation, we've hit some really important milestones since the last town hall. We've been able to invite all members of Blue Q who have indicated that they wanted to get their vaccine. We've also invited all eligible Michigan Medicine patients to come in and get their appointments, get their vaccines. We have, with a fantastic supply this week, been able to offer first dose appointments 7 days a week. And we're shifting gears. We're starting to get creative and develop some new models to deliver vaccine with low barrier. We've heard feedback about a variety of things. Sometimes people are unable to get an appointment or have trouble with the need to scour and find available appointments. Some people have had difficulty with scheduling it or finding a convenient time that works for them. Sometimes transportation can get in the way. So we're doing everything we can and are deeply committed to breaking down every one of these barriers and give everybody access to this protection. We have a ways to go to get back to normal life, but I can tell you that it's also been very rewarding to see life at least partially rebound for some individuals who have been vaccinated. Seen friends and family reconnect with friends and neighbors, gather with families, and celebrate life's milestones safely together. While we're committed to breaking down barriers, I also acknowledge that there remains an internal barrier for many of us. There can be a true fear of vaccine or even just lack of motivation to get vaccinated. Within our operation, I thought it might be helpful just to share a little bit of the feedback we've gotten so far with 100,000 doses administered to date. What we're seeing is pretty consistent with what the CDC set out as expectations. So we know that some recipients feel nothing at all and doesn't skip a beat. Other recipients are experiencing sort of the injection site, some muscle pain, similar to what you would feel after a flu shot if you've had that done before. It typically goes away in a day or so. And my 8 and 10-year-olds get ice cream cones after their flu shot. So I highly recommend that as a strategy to deal with that side effect. Some individuals feel tired or have more intrusive side effects listed here, like headache, sometimes body aches or fever, chills. Most of that is manageable with over-the-counter medication, ibuprofen, or just taking a day of rest. All of us need that right now anyways, and bounce back feeling great and ready for another day. Herd immunity can be achieved through either natural or resistance built by the vaccine. And these side effects pale in comparison to the potential devastation COVID can have on one's health. COVID-19 has taken 569,000 American lives. The vaccines, risks, and all have saved millions. If you look at the websites, we've shared them before. This week, we are operating at Michigan Stadium. We have Pfizer. We have Brighton Health Center operating with Moderna. And Michigan Stadium actually, Friday, is a walk-in clinic. All you need is a medical record number. We also have appointments available at both throughout the week. We have some opportunities with Meijer. There's a special session for UM. You text the word Go Blue to 75049 to get in their registration queue. The local county health department, I know here in Washtenaw, they're offering appointments 5 days a week. So there are a lot of options there. And if you need help finding where to go, if you're interested and just want something really easy and convenient, you could probably find it while you're shopping at Meijer, but several areas are now providing it locally. So CVS, Rite Aid, Hello Med, the urgent care, Walgreens, Packard Health has vaccine, Costco, Sam's Club, Save More, and many other pharmacies. I actually even have a friend who got it from a greenhouse, getting their landscaping materials a couple of weeks ago. So vaccines are available. That shouldn't be an issue anymore. We've come through that period of time where that's a really scarce resource. So go get your vaccine. You've heard me talk a lot about vaccines. I wanted to take a moment too to share some information about our increasing number of delivery of therapeutics. We have a fantastic team led by Dr. Lindsay Petty and Dr. Tejal Gandhi, who have navigated getting our therapeutics program stood up. I have a really proactive process to identify people who have COVID and are eligible to receive the therapeutics. With the monoclonal antibodies, we've seen some really incredible results. So out of the 865 infusions that we've delivered to date, all patients have survived COVID. Over 96% of those recipients have avoided hospitalization. So this is not a cure. This is not the be all end all, but it certainly helps. Therapeutics like vaccines are still a scarce resource and are not readily available for every member of our community who catches COVID. It's not enough to stop the pandemic, but it's incredible progress. And I want to give kudos to the team out at West Ann Arbor and our leaders for getting this program and growing the program as the needs need to be met. We are also taking referrals from outside sources to get their therapies at Michigan Medicine, come here for their treatment. There's hours of operation at Western Arbor that are Monday through Friday, and because of the needs lately, we've expanded that to include Saturdays as well. And key partnerships are in place when patients are unable to come into the clinic for their vaccine, will come to their home, and that's through the Huron Valley. Our EMS partners and Home Ed are starting this week as well. So we're doing everything we can to help when we don't prevent COVID, to treat it and keep people out of the hospital and well. Thank you very much. I'm going to hand it over now to Dee Hunt, our Chief Human Resources Officer.
Hello, I'm Dee Hunt, Chief Human Resources Officer for Michigan Medicine. Protecting the Michigan Medicine family comes first. Clinical, clerical, support staff, facilities, supply chain, office professionals, those who work on the Hill, in your offices, or at home, you are our priority. With regards to COVID vaccinations, with the increase of available vaccines and vaccination clinics, we need to continue to practice flexibility. Leadership and staff are asked to continue to work together as we address this pandemic and get vaccinated. Health concerns. If you're not feeling well, please do not come to work. We want to prevent the spread of COVID. Follow up with your physician, get tested for COVID, or call OHS for directions and advice. There are a few walk-in clinics being piloted. One in Ford Auditorium for selected groups of employees, and a walk-in clinic at Michigan Stadium on Friday from 10 a.m. to 4 p.m. for employees and patients. If you haven't been vaccinated, please take advantage of these two opportunities. Again, these are pilot programs only, and we encourage employees to monitor the ops update for future walk-in options. Appointments can also be made in MyChart with your Michigan Medicine MRN number. Michigan Medicine also provides support. We have our wellness office, our Office of Counseling and Workplace Resilience, mHealthy, and recharge rooms located on the Hill. Self-care is so important. We ask that you take care of yourself physically, social, mental, spiritual, and emotional needs. Self-care is knowing who you are and knowing your limits, finding ways to decompress throughout the day, getting the sleep and rest you need, and love yourself. With regards to remote work, our Michigan Medicine Committee continues to work on flexible and remote strategies. Staff who can and who have been approved to work remotely should continue to do so until Monday, September 13, 2021. We ask that you please take care of yourself, stay safe, stay healthy, and always be kind to yourself and each other. The executive team of Michigan Medicine, thank you for all you do, because you are really making a difference.
Thank you, Dee. In closing, I want to acknowledge the importance of our core values throughout the pandemic. We've seen in both big moments and small moments demonstrations of caring, integrity, inclusion, innovation, and teamwork that have sustained us over the last 14 months and allowed us to continue providing exemplary care for our patients. None of this is easy, and the flexibility and commitment of our teams has been remarkable. Your care for our patients has been outstanding, and your care for each other is inspirational. Thank you, and let's keep going together.